Hi, everybody, and welcome to another segment of MedTalk brought to you by Medical Tourism. Right now, I have as a guest Dr. Carlos Garcia, a urologist with over 30 years of experience and has his practice all the way in Vallarta. We talked about benign prostate growth, and right now I have a couple of questions for the doctor for our international audience who are curious and want to visit Puerto Vallarta to get that done. Hi, doctor, how are you?
Hi, how are everybody? Thanks for the invitation.
Thanks for your time. Doctor, if I know I have a increased prostate size and I want to go to Puerto Vallarta and get it fixed, how many days do I need to plan my stay there?
Well, strictly, we suggest if there are no tests and no checkups, previous checkups, we suggest at least 7 days, 10 days, so we can have a consultation, do all testings, PSA, ultrasound, urinalysis, and from there we can know exactly what is causing any symptom, any lower urinary tract symptom. If a procedure is needed, we're trying to do it in the following couple days. And of course, after all the procedures done to the prostate, as it's only one outlet, we have to leave a catheter for at least 3-4 days, and in some cases 7 days. So this is the only limitation, maybe, to go back to United States or Canada, whatever. We have experience with several patients treated that can or left Vallarta with catheters, and once at home, we follow via video conference until the catheter is removed. So at least 1 week is a good time frame for diagnosing and having a procedure done.
Can I start the whole process online virtually and send you, like, for example, my test and stuff like that? Or do I have to be there?
Absolutely. We have several patients. We have a video conference, and you can share us whatever tests, results, or image tests you have. That, of course, help a lot, so we can discuss about the findings, the results of lab tests or radiological tests, and we can do the first even couple of consultations via video, and that shortens the time for any procedure. Now, we have patients that we did this way, and they just come for the procedure. We do the next day they arrive, and 4 or 5 days later they can leave without trouble.
If you see the podcast, you're going to see that the clinic offers several treatments to treat the prostate. For example, if I'm interested in a specific procedure like a vapor or, I don't know, green light, or who decides the best course of action? I say as a patient, hey, I want this done, or it's your call based on the size of my prostate?
We have two possibilities. I have experience with a lot of patients that they read a lot and they do a lot of research about one specific treatment procedure, and they feel comfortable with that procedure, and we respect that, of course. Of course, if we have it here in the area, we do it. On the other hand, we have those patients that they don't have a specific option for treating their prostates, and they want to know what exists, what we have. In this case, well, we talk about the problem, the diagnosis, and I usually discuss all the options, as we did in the podcast, trying to explain all the details about STEAM or ultrasound or transurethral resection, laser, enucleation, whatever. And of course, we try to discuss these pros and cons about each procedure.
Yeah, that makes sense. Well, thank you very much, doctor, for your time. Thank you very much for listening. Don't forget to check the full interview in Spanish. It was very helpful, so you'll clarify a lot of your doubts. Thank you very much, doctor, and hope to see you again.
Thank you very much for having me here, and hope you see you soon.
Bye.